Morning on Sunrise is Dr. Kothary. He is the Chief Medical Officer for Dignity Health Central California Division. He has been joining us every morning here on Sunrise for more than a month now, giving us the latest on the fight here locally. Good morning, Dr. Kothary. Thanks so much for joining us.
Well, good morning, Alex. Thanks for having me once again.
So again, we keep talking about the pending number of tests in Kern County, and that number, again, continues to rise day after day after day. And what we're seeing is that there are more pending tests being added to the number, the total number, than test results coming back. What does this mean as we continue to fight this? Is this concerning to you as you look at the number of pending tests compared to the number of daily cases added each day?
You know, and I think it is somewhat concerning, but I'm still being a little cautiously optimistic. I think a lot of people are getting out there because they think they may have the virus. We're a little looser on testing nowadays as well. So I'm hoping that a lot of these tests do come back negative.
Why do you think our death rate is so low? I mean, we have 652 total cases, and unfortunately 3 people have lost their life from coronavirus in Kern County. That, again, is too much. But still, you look at how forget the rest of the nation. Let's just focus on California for a second. You look at the fatality rates for California, and our fatality rate is minimal compared to other counties in California. Why do you think that is?
Well, one of the first things that I believe that really helped us is when we shut our state down. We actively went a little earlier than most people would have expected. We started social distancing early, so I think that brought the numbers down. The other thing is when these patients end up in the hospital, I think our doctors are being extremely aggressive and making sure that we take care of them quickly. You know, we are taking more aggressive measures than we typically would because we know how deadly this virus can be. We've seen it in New York and other countries around the world as well.
I want to talk about a little bit about the treatment that we're seeing done in hospitals. Again, we should say that 22 people right now at last check are in Kern County hospitals fighting this virus. What are some of the treatments that hospitals are using to fight this? Because again, this affects the lungs, right?
That is absolutely correct. That's where it primarily resides. And so, you know, we have on all of our cases, we have an infectious disease person and we have a critical care doctor, and they make a decision on whether to give them the Plaquenil, the hydroxychloroquine, and the Zithromax, or do they go a different approach? We're also in our division in Central California. We have started using our convalescent plasma as well. We're also looking to start doing some clinical trials with remdesivir, which is the Gilead drug that they actually closed the study, but we're trying to get back into it again. So we have a lot of different approaches that we're using currently, and I think every little approach is unique to the person.
We've heard from some hospitals that across the nation and world that what they're doing is they're actually flipping people on their bellies, which helps with their lungs in fighting this. Can you explain a little bit about that? And is Dignity doing that?
Absolutely, and that's called pruning. And so we're doing it quite often to a lot of the patients. And a lot of times we have to physically, manually prune them. And so we need several staff members to help that. We do that every few hours, and we also have to turn their heads every few hours as well, so that they don't get ulcers. I think that's a standard practice across the country now. I don't think it's unique to us, but we definitely Dignity are doing it.
What is the benefit of doing that? How does that help?
So what it does is it helps when you have what we call ARDS, which is what this virus causes in the lung. It's called acute respiratory distress syndrome. What the pruning does is it kind of helps alleviate some of that stress on the lungs. You would think opposite, but it actually doesn't. It helps alleviate some of the stress.
Now let's go back to the testing, because we've seen, for example, we're seeing some tests in Kern County come back within a matter of hours, less than 24 hours being reported. And some are taking longer to get those results. Do you think that there is a possibility that people are getting false negatives or false positives with these tests if they come back so quick?
Yeah, there is a chance that there are some false positives out there, without a doubt. You know, the sensitivity on this test is about 70%. So, you know, you have a 30% fail rate. However, it is very specific. It's almost close to 100% specific. What that means is, if you do not have the virus, the chances of you test being negative and you having a virus is very, very low. So the specificity is very high. The sensitivity is a bit low.
All right, so that is the test for coronavirus. Now I want to go to the antibody testing, which is something that we're hearing a lot about lately. And some people say that that is the key in order to get the country back up and running. Where are we on getting an accurate test for antibody testing? And do you think that that is something that we could see here in Kern County soon?
So I will tell you specifically for Dignity Health, we are vetting some of these tests. We are also waiting on the CDC. What has happened is the FDA has let a lot of these companies do these tests and make these tests. However, the CDC has not come out on a recommendation to use these tests. So we're waiting on them primarily. The other big concern we have, and what we're trying to vet out, is how soon after you get the infection will you start producing antibodies? So we don't know the answer to that. And there's a couple different types of antibodies. We don't know which one is more protective. There's what we call the IgM and the IgG. We don't know which one's more protective. So I think the antibody test is going to be a good test, but we're still waiting and working the kinks out.
Is it looking promising? Is there pressure from the CDC?
Very promising, yes.
Is there pressure from the CDC to get this going?
I believe they've had a lot of pressure, being that there's already, I'd say upwards of 100 companies making these tests. The CDC, from what I know, is vetting out 60 different companies. So as soon as they come out with a recommendation, we at Dignity Health will go ahead and move forward with that.
All right, well, there's a silver lining right there. So thanks so much, Dr. Kothary, for joining us this morning, giving us an update. Again, you will be with us tomorrow morning at 6:30 to give us more information and the latest on the coronavirus crisis here in Kern County. Take care of yourself, Doctor.
Well, thank you. Thank you very much, Alex.
All right, more news.